Hello today, you beautiful people. So in today's video, we're gonna be talking about nature's amazing gift to us, that is zits and pimples. Acne vulgaris is a common skin condition characterized by chronic or recurrent development of papules, pustules, or nodules. As an aside, I don't know how you guys feel about those words, but I find them extremely cringe. And these things can be located all over, let's face it. I mean, on your body, your neck, your trunk, really anywhere. Now, the pathogenesis of acne vulgaris involves the interaction of multiple factors that ultimately result in the formation of comedones, and these are the blackheads or the whiteheads. Now, what happens is there's your skin pores or your hair follicles that are clogged with oil, dead skin cells, and bacteria, and ultimately it's a whole host of these things that involve inflammation, and that results in your zit formation, basically. Now, I'm just gonna pause for a second, and if you haven't already, remember to subscribe and give the video a like, as it does help me out. Now, acne is most frequent among adolescents and young adults, but it's not limited to these ages. I mean, let's face it, we've seen plenty of people through adulthood that end up having a very serious issue with acne. It's a super common thing. The severity of the skin involvement varies from just minimally a couple of zits here and there to very much being a disfiguring and highly inflammatory presentation. And then there's obviously everything kind of in between. The diagnosis is pretty easy to make. I mean, it's straightforward. Most of the time you can just look at a person and know. It's based on history and physical exams, so you don't really need a bunch of lab tests for most patients. So let's talk about androgens real quick. Now, androgens induce sebum or oil production, and these are an important factor in the development of acne. And that's why you see so many people develop this in puberty. Well, because you're having higher levels of testosterone. Have you guys heard of steroid acne? Now, that's another similar thing where you kind of give your body more of a reason to break out because you have all this exogenous testosterone. Did your guys' mom ever tell you to stop eating chocolates, maybe drinking sodas or other fatty foods? Because mine certainly did. The role of diet in acne vulgaris is kind of an evolving concept, and there's been a contributory effect of milk and foods with high glycemic index, and those types of things have been proposed, but the prospective trials are still necessary to kind of clarify that relationship between diet and acne. So basically, we don't know. So what complications can acne have? Now, commonly you see post-inflammatory hyperpigmentation. As with other inflammatory skin conditions, acne may lead to the development of hyperpigmentation. The risk for hyperpigmentation increases with increasing baseline skin pigmentation in general. So basically, darker skin complexions are at higher risk of developing hyperpigmentation. Post-inflammatory hyperpigmentation may resolve spontaneously, or it may persist for several months or longer. It all depends. The other common complication is scarring. Now, acne scarring is a super common consequence of acne vulgaris that occurs in patients with inflammatory acne typically, and it's more likely to result in the actual scarring than just a couple of small zits here and there. Why scarring occurs in some patients and not others, despite similar manifestations of acne, is not clear. We don't really know. So let's get to the million-dollar questions. Do you pop your pimples or not? To be honest, I'm not sure. I don't think there is a clear answer for that, really. As a forewarning, my answer is kind of going to be based on my personal reasoning, but I think let's reason and talk about it together. So you see a blackhead on the surface of your skin. It's probably okay to pop it, but you want to ensure the basic things, right? Like make sure your hands are clean, sanitized. You only squeeze out the pus or the blackhead, and then you apply adequate pressure, keep the area clean, avoid introducing anything that can cause an infection. I've heard of some places say you can use like a clean needle and actually dip it in alcohol, place it on like a little stove, get some fire on it, and make sure you've killed all the bacteria, and kind of use that to poke a small hole to drain the fluid. I would recommend going horizontal and not vertical to allow for the drainage to occur, but at the same time ensure that there's actual minimal trauma to avoid acne scarring. Obviously, acne scarring, that's the big risk that you're gonna run with popping pimples. I think we all know that, but hear me out. Having just really bad long-standing acne is also in and of itself a risk factor for having acne scarring and hyperpigmentation, and just from the sole fact that you had long-standing acne. So popping some of these superficial zits, well, if done correctly, it may not actually be the worst thing. Now let's talk about treatments. Medications that are effective for acne include topical retinoids, and these are the creams, lotions, the gels that contain your medicine derived from vitamin A. So benzoyl peroxide, salicylic acid, these are common ingredients you see in your Neutrogena, your Clean and Clear, all those over-the-counter brands, those facial cleansers. And these are things that can be like a first-line treatment. For patients with inflammatory lesions, benzoyl peroxide is what the literature actually says is the preferred agent because of the drug's antimicrobial properties. Now, as a teen, I remember I had issues with acne, and I remember feeling so frustrated because I'd go to the doctor and they'd give me benzoyl peroxide, and that did not do jack for me. But it is the recommendation. Now, for patients with mild to moderate inflammatory acne with or without prominent comedonal lesions, it's suggested that you use these same previous medications, but now you add on topical antibiotics. So those things like azithromycin, clindamycin, doxycycline. Of note, when benzoyl peroxide is used with the topical antibiotics as a combination, it's more effective than either agent alone. And this is based on current data. For patients with moderate to severe inflammatory acne, you use the same as the previous treatments, but now you can add an oral antibiotic rather than just the topical agents alone. Your oral antibiotics should be used for a limited course typically, because ideally you don't want to use them for over 3 or 4 months because they have their own set of side effects. And a lot of times these can include like uncomfortable stomach side effects and things like that. Now, if all that doesn't work, patients with severe inflammatory, nodular, cystic acne, they're generally treated with oral isotretinoin or Accutane. This is the equivalent of bringing in your big guns, the tanks, the rocket launchers to the party. For you Call of Duty players, this is the class where you've got the dual-wield shotguns, the Barrett 50 cal, and man, is this stuff effective. Now, the drawback for Accutane is that for younger women, this med is actually teratogenic, meaning you can't take it in pregnancy. Now, what about situations where the breakouts go away, but now they come back? So that's a common occurrence actually. Acne may persist for years, and in patients with acne that's improved with therapy, the recommendation is moderate to long-term treatment with a topical retinoid for maintenance therapy rather than just discontinuing everything upon resolution. Use it for a while after just to prevent any type of relapsing acne. Now, for acne-induced post-inflammatory hyperpigmentation, if you're suffering from this, it's not a bad idea to use a topical retinoid as a component of your acne therapy, as well as some other things like hydroquinone, azelaic acid, chemical peels. Those can also be beneficial. Now, what about other treatment options? Let's say for whatever reason you can't do any of the above things. The role of laser and other light-based therapies in the treatment of acne is not clearly defined. It's recommended that light-based therapy should not be used as a first-line treatment for acne. They can be used, and they often are, as an adjunct to other things, but there's still some other studies that are needed to kind of clarify their role. Another option is using superficial chemical peels. However, it's important to note that chemical peels should be avoided in patients taking oral isotretinoin, and they should be used in caution in patients with darker skin pigmentations in general. Until further evidence is available, there's still not a whole lot evidence about microdermabrasion. However, as far as scarring goes, anecdotally, many people have reported vast amounts of improvement. One last option is actually using intralesional steroids for individually selected nodular inflammatory acne lesions in order to accelerate their resolution. So this is actually a pretty effective therapy, and I actually had it done once when I was a teenager. Basically, if you get those kind of pimples that are underneath the surface of the skin, and it's like no matter what, you can't get them to like clear, it's been a couple weeks, what you can actually do is go in and have them inject that area with steroid. And you gotta be warned, there's still potential serious side effects because steroids have so many hosts of different things that they can do. So all in all, it's really important to talk to your doctor in regards for the best treatment option for you. What I typically do now is I just use a gentle Cetaphil face wash, and I use that twice a day, morning and night, and I find that it works for my skin. So I'll do another video on skincare routine and what I kind of personally do. So anyways, I hope you guys learned something. I'll see you guys in the next video. Keep being a boss.